Hi, Sparky here. I'm a registered dental hygienist and today I wanted to make a video in regards to whitening. So the problem with stain is it's not just cosmetic. It creates a rough surface on your enamel and bacteria will use that rough surface to build on. So you're more likely to get a cavity in areas of stain. If stain remains on your teeth for a long period of time, it probably will not come out. So think of you spilling coffee on your white shirt. Within the week, if you try and wash it, it will probably come out. If you throw it on the floor of your room and try and wash it 3 months later, it's probably going to be a permanent stain. So teeth are porous, and if somebody comes in and they haven't had a cleaning in 10 years and they've been smoking and drinking coffee and tea, I'll do my best to remove the stain, but chances are most of it is going to be permanent. Many things darken teeth over time, and teeth darken naturally as we age. Most teeth are slightly yellowish. On occasion, some are slightly grayish. The number one most staining to teeth is chlorhexidine. This is a prescription rinse that is given post-surgery or if somebody has a really bad infection or advanced perio. Most people will never have this rinse prescribed to them in their lives, and if they do, please, you need to take it. If it's prescribed to you, you need to take it. The second most staining is betel nut. Betel nut is a stimulant seed chewed by some cultures. It stains the teeth a reddish color. The third most staining is smoking. The fourth is tea, which sometimes surprises people, but do the experiment at home. Leave tea in a cup, leave coffee in a cup for a couple hours, then dump them out. See which one has the ring around it. It's the tea. It's stickier, it has more tannins. The fifth most staining is coffee. I have noticed stain from other things like darker protein drinks, spices, marijuana, royal jelly, the list goes on. There's a common myth that black people have whiter teeth. Sorry, but I have that dental light in a variety of nationalities, mouths, on a daily basis, and I see a variety of colors. They can just appear whiter from a distance when a person has darker skin. So let's say you wanted whiter teeth. Get a tan, put on some dark lipstick, and your teeth are going to appear whiter. Many things claim to whiten your teeth naturally. I'm going to try and talk about most of them today. So turmeric. Turmeric is a spice that is great for your health and it has cancer-fighting properties. Brushing it into your teeth will not whiten your teeth. I see clients from a diverse cultural background and some use a lot of turmeric in their cooking. I've noticed bright yellowing of the occlusal surface, which is the biting surfaces of their teeth. In one woman, it was so pronounced, she explained that she ate spoonfuls of turmeric each day to fight cancer. Baking soda. Baking soda can remove surface stains. It can also elevate the pH in your mouth, which is great because caries and dental damage happen in an acidic environment. Caries means tooth decay or cavities. The chemical word for baking soda is sodium bicarbonate. So if you have high blood pressure, you should refrain from use. It will not whiten the color of your dentition, only remove extrinsic stain, which means surface stain. Oil pulling. I think oil pulling is great for removing bacteria in your mouth. It also could possibly remove surface stains because of the friction of moving oil back and forth. I don't think it could change the color of your dentition though. Banana peel, same thing. You're rubbing that on. It could possibly remove surface stains, but I don't think it could change the color of your dentition. Please do not rub strawberries into your teeth. I do not believe they could work. They are acidic and could damage your enamel over time. Whitening products do work, but here's a warning. They can cause sensitivity. So I like to use the analogy for my clients of hair dye. Many hair dyes on the market claim that after your hair is healthier and shinier. Everyone who dyes their hair knows that this is not true. Your hair is damaged after you dye it. Just like your teeth are damaged when you use whitening products. Even if it says enamel safe, it's not true. So sometimes sensitivity can occur. Whitening products work on two levels. They will remove extrinsic and intrinsic stains. So they will remove any surface stains and whiten within your tooth. So with whitening toothpaste and rinses, if you notice any sensitivity or the tissue slothing away, you should cease use. So by tissue slothing away, what I mean is maybe 20 minutes to an hour after you start noticing white strands coming away from the inside of your mouth. That means it's damaging and drying out your tissue. You probably shouldn't use it anymore. Whitening strips do work. I have clients that report zero problems with them and some that report extreme sensitivity. Myself, I've used it twice. First box I got, I think I was only able to use it like 3 sessions, and I had to put the box aside because I had extreme sensitivity. Had to change to a sensitive toothpaste for a couple months and then give it a go again, but I did notice a color change. Second time I used it, I felt like the box was a dud. No sensitivity, no color change. I was kind of upset because I think the boxes are about $36 or so. Another option would be to get a tray made at a dental office and then purchase the gel through them. So it's custom trays to your upper and lower teeth, and you just put 1 drop of the gel in. You can use it at your leisure at home. Only 1 drop is necessary. It's not like the more you put on, the whiter your teeth get. 1 drop only, because if you put more than that, it's going to seep onto your gums and cause slothing and pain. I did it once. We did trays in dental hygiene school and got the gel. It did cause sensitivity, but it did lighten my teeth. I don't recommend Zoom whitening if you have sensitive teeth. One of my friends got Zoom whitening done and said she had to be on Advil for a week just because her teeth were throbbing in pain. So with any of those whitening things I just mentioned, the Zoom, the gel, the strips, for best results, I would recommend an all-white diet. Just because what's happening is the whitening will open the tubules in your teeth and clean them out. So when they're open, it actually takes a while for them to close again. So while they're open, they're more susceptible to staining. So no coffee, no tea, no smoking, no red pasta sauce, etc. I've only actually met one person in my life where their teeth did darken when they did whitening, and it was because they were a heavy coffee, tea smoker. An electric toothbrush is often what I recommend to clients who ask me of how they can get whiter teeth. I notice people who use them have whiter, cleaner teeth and healthier gums. Hi, Sparky here. I'm a registered dental hygienist, and today I wanted to make a video in regards to whitening. So the problem with stain is it's not just cosmetic. It creates a rough surface on your enamel, and bacteria will use that rough surface to build on. So you're more likely to get a cavity in areas of stain. If stain remains on your teeth for a long period of time, it probably will not come out. So think of you spilling coffee on your white shirt. Within the week, if you try and wash it, it will probably come out. If you throw it on the floor of your room and try and wash it 3 months later, it's probably going to be a permanent stain. So teeth are porous, and if somebody comes in and they haven't had a cleaning in 10 years and they've been smoking and drinking coffee and tea, I'll do my best to remove the stain, but chances are most of it is going to be permanent.